Good morning. Let me first thank Citizen Action, because if there was ever a time for citizen action, it is right now in our country. So I appreciate their leadership on the fight for universal health care and so many other critical issues. I'm thrilled to be here with two tireless advocates for New Jersey families. Congressman Pallone, as the senior Democrat on the Commerce Committee, plays a critical role in health care in our nation. And Bonnie Watson Coleman has just been such an advocate for our families, for the concept that in the greatest country on the earth, there isn't a person who should go to sleep at night worried about their health care and the consequences of not being able to afford a serious disease. We come together not only to celebrate 53 years of progress achieved by Medicare and Medicaid, but to stand up for the basic idea that health care is a human right. And I'm also thrilled to have Ady Barkan here, who captured the hearts of Americans everywhere when he challenged my colleague, Senator Jeff Flake, with his powerful case for protecting Medicaid. So we're glad you made New Jersey a stop along the way, and really moved by you using your personal challenge into a national cause. So thank you very much. You know, it wasn't so long ago that Donald Trump campaigned on providing better, cheaper health care to all Americans. Yet instead of making anything better, the president is making everything worse. Under his watch, big corporations are swimming in trillion-dollar tax cuts, while working families are drowning in higher premiums, higher deductibles, and higher prescription drug costs. After spending years voting again and again, as Frank and Bonnie can tell you in the House of Representatives as well as in the Senate, we spent too much time with Republicans trying to repeal Obamacare, that it's amazing to me that Republicans have no desire to remind voters now of their repeated efforts to take away health care for millions of Americans. But Americans are not going to forget how Republicans spent years trying to take health insurance from 32 million people, including 1 million right here in New Jersey. I don't think they're going to forget how Republicans tried to defund Planned Parenthood and deny millions of lower-income women access to basic care. I don't think they're going to forget how Republicans voted to end Medicaid as we know it, jeopardizing 1.8 million seniors in nursing homes, disabled New Jerseyans, and working families who just live paycheck away from poverty. Nor will Americans forget how President Trump turned his back on patients with pre-existing conditions. The president promised again and again that he would hold protections under whatever his vision of health care was going to be for pre-existing conditions and allow no discrimination against it, as the Affordable Care ensured that there could be no discrimination against someone who had an illness or a disability or born at birth with some birth defect that previously could be discriminated against. And the Affordable Care Act eliminated that discrimination. Here in New Jersey, 3.8 million New Jerseyans have a pre-existing condition. I was actually amazed at that number. I sat down with my senior health staff and looked at the research. 3.8 million New Jerseyans, a little over 9 million people in our state. 3.8 million New Jerseyans have a pre-existing condition, which means without the protections of the law as it exists today, 3.8 million New Jerseyans are susceptible to being discriminated against once again in either getting no insurance whatsoever or having to pay through the roof to be able to get that insurance. But now, instead of defending that, the Trump administration is arguing in a federal court that these very protections are unconstitutional. That's right. The administration is actively working to return us to a time when health insurance companies could deny coverage to people with a pre-existing condition. Trump's reckless reversal on this issue is even more frightening, given his nomination of Judge Brett Kavanaugh to the Supreme Court. This is a judge with a long record of ruling against consumers and for big corporations, of undermining the right to choose, and yes, of assailing the constitutionality of the Affordable Care Act. As I said, there are 3.8 million people in New Jersey who have a pre-existing condition. That's 3.8 million reasons for me to be opposing the nomination of Brett Kavanaugh. If Republicans were really concerned about protecting patients, they'd put the brakes on this nomination. But after stealing a Supreme Court seat left vacant by more than 9 months left in President Obama's term, they will stop at nothing to shift the Supreme Court to the far right for generations. Now, whenever I hear talking heads on TV say they don't know what Democrats stand for, I shake my head. If there's any principle that unites everyone in the Democratic Party, it's the idea that in the greatest nation on earth, no American should go without access to health care. That's why President Lyndon Johnson and a Democratic Congress stood up to wild Republican warnings of socialized medicine and passed Medicare and Medicaid, and left behind a dark time when seniors, the disabled, and the poor languished without care. And for me, this is not just an intellectual enterprise. It is the actual reality of having lived a life in which I saw my mother, who was a seamstress in the factories of Hudson County, worked incredibly hard to raise her children and give them a better life than she had in her life. And in the twilight of her life, as she faced a long decade of struggles with Alzheimer's, if it wasn't for Medicare and Medicaid, she would not have lived with the dignity that she deserved in the twilight of her life, as well as what my sister and I were able to afford to supplement that as we were trying to get our kids through college. These intergenerational struggles that so many families in our state and in our nation face are assisted by the baseline of Medicare and Medicaid as health care security for our parents. It's also why Congress created the Children's Health Insurance Program in 1997, so every child would have a shot to grow up healthy and reach their potential. Why I'm thrilled that I led the effort to have that renewed for another 10 years. And that's why we stood with the President Obama, to pass the Affordable Care Act in 2010. That's why we'll never stop fighting until there is universal health care coverage for every man, woman, and child across America. So would it be nice if once in a while you flipped on the TV and we saw the pundits ask what the Republican Party stands for as it relates to health care? Because in recent years, here's what I've seen them stand up for. They fought to privatize Medicare and turn it into a cheap voucher program that leaves seniors with massive medical bills. They fought to end Medicaid as we know it by turning it into a block grant or instituting per capita caps, which are really a fancy way of saying they want to take millions of disabled Americans, nursing home patients, and working people and have them lose their health insurance and not get the care that they need. They fought to strip 32 million Americans of their health care coverage. They've done nothing to help families afford prescription drug coverage. And now, after exploding the national debt with trillion-dollar tax cuts for big corporations, they're already calling for so-called entitlement reform. In other words, slashing the Medicare and Social Security benefits that our seniors paid for, and I believe they're entitled to. So let me close by saying I think the American people have had enough. They're rising up. They're making their voices heard. They're registering to vote. They're knocking on doors, and they know that this is a fight worth fighting for and that we can win. That's how we're going to stop Republicans from remaking the Supreme Court in their right-wing image. That's how we're going to protect patients from pre-existing condition discrimination. That's how we're going to uphold time-tested programs like Medicare and Medicaid. That's how we're going to not just defend the Affordable Care Act, but build on it with some bold solutions that expand coverage and lower costs for families. This year, the stakes have never been higher, and the voices of everyday Americans have never mattered more. This is about dignity. This is about human rights. It's about making sure that every American has access to quality health care, no matter where they live, how much money they make, or what health care challenges they face. And come November, the American people are going to remember who's been fighting for affordable health care and who's been trying to take it away from them. I'm proud to know which side I'm on. I'm on the side of citizen action. Thank you very much.